Thank you. It's great to be here. Thanks for the nice introduction. And I'm so delighted that you're here to learn a little bit more about chronic pain and what we can do about it. So these are my disclosures. I predominantly work with companies and groups who are trying to create more opportunities for patient pain self-management. And so today we'll talk about, first initially, chronic pain and its incidence in the US, but also how it impacts people with scleroderma. Then we'll talk a little bit about the neuroscience of pain, but hopefully in a fun and interesting way that'll be clear so we can start making the connection between pain and the brain. And then we'll talk about the concept of resilience. This is where I live. I'm very interested in the patients or the individuals' resources they have and how to marshal those for better outcomes. And then I'm going to teach you a number of the interventions that we study and have been shown to be efficacious for everything from improving sleep to activities and to certainly to living with pain. So we begin with the notion that there is an epidemic, and there is. So chronic pain is defined as pain that lasts more than 3 months. About 21% of the US population currently has chronic pain. Pain often disrupts people's work, ability to socialize, ability to do the things in their life that really matter to them. As such, it's also associated with depression, anxiety, and other medical conditions like Alzheimer's disease and other dementias, higher suicide risk, abuse of substances, and the list goes on. And then about 7% of the US population has something we refer to as high impact chronic pain. That just being pain that's just incredibly disruptive and extremely costly for us to treat. And then lastly, in a really interesting epidemiologic survey about a year ago, they found that new instances of chronic pain occurred at a much greater rate than very common conditions like diabetes and depression, and almost, or actually a little bit more frequently than even hypertension, which is also considered a major epidemic. So when we think about pain and scleroderma, number one, it's extremely common. About 75% of people who have scleroderma report that they have some pretty significant chronic pain, and that often this pain is pretty resistant to treatment. It doesn't get better when biologic drugs or other medications are used. Maybe other symptoms are quelled, but the pain persists. And then also reported by people with scleroderma, it's not just kind of this pain that's stable, but there's really some significant flares that can take place that are really quite devastating, lasting for days and even for weeks or months. What we've learned, though, other studies have shown us that having a greater self-efficacy or belief that you can actually do things to improve your pain is highly associated with having less severe pain and also less pain interference or better functioning. But here's where we have a problem. So people who have scleroderma report that they have worse self-efficacy for dealing with their pain than I don't know how to deal with pain. And that's a failure of us as healthcare providers, that we are not getting the tools to you that you need to better work with your pain and learn how to use some of these tasks and activities to make your pain better. So I begin with the notion that chronic pain is not easy to treat. It is complex because frequently chronic pain comes along with depression, poor sleep, fatigue, cognitive fogginess. So we're really often not just targeting pain, we're actually looking at a whole symptom complex. And then things like stress, aggravation, depression itself, sleep, all the things that kind of come with pain also make it worse. When we treat pain, we really need to do it in an interdisciplinary way, which means that we can't just throw medication at it. That's often a first line, but it's highly ineffective. And so pain medicine physicians will also use other types of interventions like injections, but really where the sweet spot really is physical therapy and occupational therapy, getting people moving, stretching and strong, and also behavioral therapies, working with the sleep that may be disrupting your pain, or working with mood or anxiety that are very, very commonly come along with chronic pain, as well as just learning tips and skills to get more active. This is needed because pain is really complex. We often just think about pain as a sensory experience, ow, I stepped on something really sharp, I have pain. And yes, that's true. That is kind of true of acute pain. But chronic pain is quite different. And not to say that acute pain isn't influenced by our emotions and by our thoughts, but this is particularly important in chronic pain. This is true because pain is not processed by just one little area in the brain. It's processed by many areas and networks that interconnect with each other. And what's so interesting is that these same networks and areas that process pain often are the same areas that process emotions and thoughts. And so it all gets kind of mixed in there. So we begin then with the notion that neuroscience, we need to understand what's going on with the brain to understand how we can better intervene. So I'm going to tell you about just kind of some weird studies that tells us how amazingly odd pain is. So the first thing that we have shown over and over again is that an MRI or any radiograph is not usually a great predictor of chronic pain. That if you were to look at this, and I ask somebody in radiology, say, hey, where's the pain? They'd say, oh, it's right there, where the bone is rubbing on bone. That's where you would have a lot of pain. But what we often see is somebody whose knees look just like that, they have no pain. It's exactly what my left knee looks like. It's terrible, and I have no pain. So, and then other people will have a very normal looking knee like the one on the right and have tremendous pain there. Another odd thing that can occur, this is reminiscent of a 29-year-old construction worker who took an unfortunate leap onto a nail that was poking up, and he almost passed out. He was in such tremendous pain. So his colleagues grabbed him, they ran him to the emergency room, they plopped him down, they rushed him in, they gave him opioid medication because he was just in egregious pain. They get the nail out of the boot, they take the boot off, and see that the nail went right between the toes. There was no scratch. His pain was real. That was real pain. What the brain does is it works on context. It'll put, oh, this happened, these people are freaking out, and oh, look at it, it's coming through my foot. And the brain will says, this is an emergency, this is an alarm, hurt. And so that's just one of the amazing things that the brain can do. We know that maladaptive thoughts like pain catastrophizing or fear avoidance all make pain, physical pain. When we do testing, they make it worse. But more adaptive thoughts like optimism and a sense of pain self-efficacy and just feeling kind of good about life in the world make pain better. And this is with pain testing and other types of experiments. We did an interesting experiment, the phrase study. We know that attention and distraction are very, very powerful for how we process pain. In this study that we did, we gave women in the first stages of labor these virtual reality goggles, and they had this beautiful ocean scene that was so serene and lovely. And we just wanted to make the women their own control. So for one set of contractions, they get the goggles and get to see the ocean, and the other ones we withheld them. And all we wanted to know is would they do it and would they get really nauseous? That's what we were so worried about. Well, what we learned is not only did they want to do it, but in the contractions where we took the goggles away, they were yelling for them. What we saw is that pain was reduced by up to 40% during the contractions where they had the virtual reality goggles. We know intense negative emotion like anger, fear, hatred all make pain worse, but positive emotion, laughter, joy, love, calm, and especially heavy-duty laughter. When you have really, really intense laughter, you actually release endorphins. You actually release analgesic or chemicals in your body that actually decrease pain. And then we know social isolation and loneliness are very, very strong predictors of who experiences more pain. And then social connection actually, again, reduces the experience of pain. This is an illustration of the TAR study, and actually what they did is they had people dance together in groups to Gangnam Style, you know, that really crazy dance. And when they did that, they actually had lower pain, they had higher pain thresholds, they could withstand more pain. So even something as silly as dancing together can be pain protective. So what these studies kind of tell us about this really big literature is that the door is open to resilience interventions because cognitions, emotions, sensory experiences are all neural events, just like processing pain. And all of these are processed by many of the same areas, the networks and areas of the brain. Damage and tissue injury where pain is concerned is optional. right? It can happen without. And that psychological, emotional, social, attentional processes are really intricately woven into the pain experience, and that changes in the brain networks that are the cause of chronic pain are not hardwired. They are malleable, even into late adulthood and so on. So neuroplasticity, the notion that the brain can always rewire, makes some pretty amazing relief possible. Okay, so let's talk about the concept of resilience. That which does not kill me makes me stronger. That is the heart of resilience. That you have to have bad things in your life. You have to have adversity to be resilient, right? They kind of go hand in hand. And that when we think about what is resilience, it really is just the ability to adapt, to bounce back. What we've learned, though, is resilience isn't something you have or don't have. It's actually something that you can learn. It's it's kind of adaptive and plastic kind of concept. You can continue to grow it. You can improve resilience through some pretty simple activities. So when you think about yourself or people in general and resilience, it does occur along this continuum. So some people are kind of lowly resilient. Something happens in their life, they kind of spin out of control. Other people are pretty resilient. They can deal with a fair amount and kind of bounce back. Others are just super hardy. You're shocked how well they can bounce back from something that comes their way. And then there's others that over time actually thrive in the face of adversity. And I've heard this from a lot of people with chronic pain, that they look back at their life and think, you know what, I hated having chronic pain, but it's changed my life in ways that I actually never thought are possible. And I wouldn't trade it, as crazy as it sounds, because now I'm doing X that feels very meaningful. So thriving then is living a life that is even better than before the adverse thing happened in your life. You found something that has changed how you look at the world, and your life now is perhaps more rewarding. When we look at the science of resilience in chronic pain, it's great. It's really exciting to see that people who are more resilient tend to experience less chronic pain. They just don't have chronic pain. People who are resilient also have less widespread pain. They might just have pain kind of in one area. They use less medications. They're more likely to have less disability. They also have less sleep impairment. So people who are resilient with chronic pain tend just to sleep better. People who are resilient with chronic pain have less depression, anxiety, post-traumatic stress symptoms, and so on. And really what they're demonstrating is this kind of psychological adaptation. You know, they're kind of accepting that pain exists. They don't love it, but they accept that pain exists. They don't tend to catastrophize. Instead, kind of get into this movement that these are the things I can do. This is in my arsenal, in my tool chest, and I can do something about my pain. So when we talk about what is resilience, we try and think about it as kind of this mushy construct that's made up of a bunch of stuff. So one of the really important elements of resilience is having strong social support, is feeling connected, not being lonely, feeling like you have people who are in your court. Thoughts, how we think, is very, very important to our resilience. If we are good copers, if we have a sense of optimism, if we kind of feel like life sort of makes sense, I don't feel like I'm being buffeted by all these things that are against me. And also emotions. Negative emotions are part of who we are. You have some of them, but can you balance them out with a rich array of positive emotions too? So you want to have more positive emotions just in general than negative emotions. And so when we're crafting interventions, we think about these as resilience targets, right? So connection. I'm going to try to work with you to see that there's more social support in your life, that your relationships are as rich as possible with healthy, good people. So get rid of those toxic relationships if possible. We're going to focus on thoughts. How do we enhance optimism in the sense of pain self-efficacy? We're going to focus on your competence. Does your life make sense? Does it have meaning? And then we're going to focus on emotions. Again, how do we build some of these positive emotions? As Dr. Poole was mentioning, some of these kind of simple activities can really build positive emotions. But before we do that, a quiz. Alrighty. So this is a really cool study that it's still I love. So Julia Holt-Lundstadt did a meta-analysis, which means she went to the literature and pulled every single study that had been done about decreasing the odds of mortality. And then she put them all together and said, okay, if you have clean air, you're much less likely to die, right? Kind of at the bottom there, that's good. If you just get treatment, if you have hypertension, you get treatment, much less likely to die, that's pretty good. If you exercise and maintain a lean body mass, those are both great, right? That's gonna definitely help you be less likely to die. Just getting flu vaccine, so powerful. A simple thing like that, preventative medicine, again, very protective. Less alcohol, if you drink too much, is a very powerful predictor of, if you drink less, of survival. And then the big kahuna, less smoking, the most powerful predictor of less mortality, okay? But there's one that's bigger. Does anybody have a guess what might be even more protective than not smoking? Yes, yeah. A sense of being socially integrated, of being socially supported, of being connected. Loneliness kills. And this is really the message of Vivek Murthy, our Surgeon General, who has written a beautiful book about the effects of loneliness and what an incredible influencer that is on our health. Okay, so we need to promote social support and healthy connection. Our social relationships are really important to us. They impact both our mental and our physical health. They do this through many routes. They do it by how we act, our behaviors. They do it through our physiological pathways. If we're not stressed out, if we're feeling loved and comforted, we release all sorts of great chemicals. There are costs to unhealthy relationships, so it's important to think about where you put your effort. Healthy relationships, not so healthy relationships, right? Because negative relationships actually have health costs. They can be related to less good physical and mental health. And then these things have a cumulative impact. So if you have bad relationships over a long period of time, your health risks are much greater. If you have great relationships over a long period of time, your benefits are greater. And this is a study that we conducted with one of my mentees, Victoria Powell. She's a palliative oncologist who's really interested in loneliness, and especially at end of days. And we did a study using the Michigan Health and Retirement Study. It's a huge database that we were able to kind of go back in there and look at people at two different time points, about 10 years apart. And what we did is we looked at kind of loneliness symptoms at the earliest stage in 2006. And then we looked at what sorts of health outcomes did they have at 2016. And our question was, would this contribute to pain and fatigue, which kind of comes along with pain, and maybe depression, because they all kind of group together? And what we found was yes, yes, and yes. But what's fascinating is also loneliness very strongly predicted who would have all three of those at the same time. And there's a very powerful effect for that. So loneliness is incredibly important. I don't have a ton of time, Ross, I'd have you do this. So do this on break when we go here. But take a moment. This is one of the interventions that we love. It's just called Text to Connect, and it's the simplest thing in the whole wide world to do. Basically, what you do is you pop open your phone. Don't do it now. Scroll to the bottom. Somebody you've not talked to maybe in 4, 5, 6 months, a year. Say, oh my gosh, I've lost touch. Tap that person a little note, send them a picture, just say, hey, just thinking about you, hope you're all right. Something along those lines. And do that every day for a week and see what comes back. So we fail to connect sometimes because we get so busy that we get probably sometimes too distracted with the unhealthy relationships that we fail to keep these other relationships in place. This is a nice way to do that. Another resilience target are our thoughts. We want to enhance optimism. This is a study that we conducted with Mark Seligman and a bunch of folks at the research facility laboratory, which is what handles all the military data. So post-deployment pain is a huge problem for the military. And so they wondered what sorts of factors might be protective for when people come back from deployment and don't have pain. About 40 to 50% of returning members will report some form of pain when they come back from deployment. So we looked at a group of soldiers, over 20,000 of them, and followed them over multiple deployments and multiple exposures, and determined that after a series of at least one deployment, that about 37% of these soldiers came back with a new area of chronic pain. So they might have had one when they left, but they've got some new chronic pain somewhere in their body. And we thought, that's so cool, but we want to know what's protective. And so we looked at optimism. And so we looked at these soldiers, and they tend to be pretty optimistic. Soldiers are, especially officers, are super optimistic. And we looked at the most optimistic soldiers compared to the least optimistic, and found that the soldiers who were least optimistic had a 35% greater odds of developing chronic pain. So being optimistic was very protective against chronic pain, and we see this a lot in other studies. This is a review of studies, looked at 69 studies of optimism and chronic pain, and found that 70% of the studies said, yeah, there's a relationship here. And then these authors went back and said, okay, wait, let's look at the best studies. What are the really well-conducted experimental studies? And they found if you looked at the really good studies, 92% of them found this relationship between optimism and chronic pain. So that's very compelling that this exists. Competence, self-efficacy, and purpose. We really like targeting self-efficacy. This just means let's give you the tools that you need so that you can better manage your pain, that you feel good about it. And we know that when people have a high sense of self-efficacy, they're much less likely to have functional impairment. They tend to have less pain severity and infinitely less psychological distress. So if you feel good about your ability to cope, you tend to do much better. Another element in this category is a sense of purpose. So this is when I talked about when people tend to thrive after having an illness, it's often because they found a new sense of purpose or a new meaning in their life. And when you have a strong purpose in life, whatever it might be, it could be just, taking care of your family or helping the others in your community. When you have a strong purpose in life, it helps you make decisions. It helps you decide what behaviors to do, what things to do that day. It shapes your goals, it shapes your the people that you hang out with, it creates meaning in your life. And having purpose in life can be whatever it is to you. Talk about this in the book. So this is a big topic that I can do a whole talk on, but let's just leave purpose in life is important because the data show us that it's related with having lower levels of depression, anxiety, less stress, healthier eating, on and on and on. People who have a high sense of purpose just take good care of themselves. And those are the data citations for those things I just listed. Oh, and less pain. It's important to us. And then here's a whole section on positive emotions, because positive emotions are kind of where I live and where I do most of my research. So this begins with the notion that we in medicine and psychology know a lot about these emotions. We know a lot about depression and anxiety, and it's important to know about these things because they are important for health outcomes. In pain, they predict everything we don't want. More pain, more medication, more disability, more pain sensitivity, on and on and on, everything bad. So we do need to know about that. But we all know we are way more than these emotions. We have all sorts of wonderful emotions on the other side of the fence. Emotions like love and happiness and interest and empathy and enthusiasm and gratitude. And these similarly are associated with all the health outcomes we want, right? We want less pain, less disability, a greater likelihood to be discharged from hospital early, less likely to stay in hospital, and then just better functioning overall. So positive emotions are really important for us to nurture. The bugaboo, and again, kind of the seed of my research, is that we have some problems. Okay, so these are data from the positive and negative affect scale. So this measures positive emotions and negative emotions. On the left, that's negative emotions. You see in healthy individuals, 18 is their score. That's kind of where we are. We want a low score in negative emotions. You don't want a ton of these. And on the other side, positive emotions, you want a high score here, right? So for healthy individuals, we want this ratio to be 2 to 1. So 18 times 2 is right around 35-ish, right? Okay, so we want this ratio 2, and that's healthy. We kind of see this in osteoarthritis, a chronic pain condition. It's pretty similar 2 to 1. We start to see a little slippage as we get into systemic autoimmune disease in lupus there. We see a greater increase in the negative and lower positive. But then when we get into what we call kind of our nosoplastic, our brain pain conditions like fibromyalgia, chronic low back pain, and pelvic pain. He wasn't sure what he was doing. So what we see is we see the negative affect goes up, so we see that go up a little bit, but what we see that's even more profound is that the positive emotions are very low. So this tells us we need to build positive emotions as much as we need to decrease negative ones. And the reason we think this happens is when people have chronic illness, they often are just trying to survive and do the things in life they must do, and often put aside the things that they love to do. These are what we refer to as valued life activities. These things kind of get set aside because you gotta work, you gotta take care of the kids, you gotta pay the bills. But a life without the things that we love, the things that feel meaningful to us, is very hard to lead, and that's why we see so much depression and anxiety. And the other thing that we see on the brain level is we see changes in the part of the brain that processes positive emotion. We call the reward processing center in your brain. This is the part of the brain that when something great happens, you go, oh, cool. Right? It's a part of the brain that just kind of triggers when something happy happens. And what we see in chronic conditions, especially in chronic pain conditions, is we see that the detection is not really there. That it's almost like people are kind of feeling meh. And it's really kind of within the brain. The brain itself is just not responding to positive things that happen. And if you don't respond to positive things that happen, you don't go out and look for positive things to happen. We see this in depression and PTSD and substance use disorders where the joy part of the brain is like, good news is it's reversible. And this is a lovely study that was conducted looking at just positive activity interventions, which is like gratitude and savoring and conducting random acts of kindness. And they found that when people did a program where they did these little positive emotion-inducing activities, they actually saw changes in the reward processing part of the brain, that it actually started like turning back on again, click, right? So we can retrain the brain to be more aware of positive things. And we spent a lot of time working on that with people with chronic pain. And so that takes us to positive activity interventions. These are the things that we're doing that I want to teach you. Okay, so when we talk about positive activity interventions, these kind of come from the school of positive psychology, which is one of the many different kind of movements in psychology that say, hey, can we challenge the status quo? Maybe we want to focus not only on negative, but let's focus on positive emotions. And so a bunch of activities were created and tested. So all of these that I'm telling about have some pretty strong research behind them. They not only improve mood, but often improve pain and other types of health. And these can include gratitude activities, acts of kindness, savoring, pleasant activity scheduling, positive daily reflection, purpose in life, and strength. So I'm going to tell you about each of these. Okay. Oh, and I'm going to do this because the data are good. This is a meta-analysis. This is a study of studies. So 16 studies were looked at, and they squish all the data together and kind of treat it like one great big study where people with chronic pain did these little silly things. They did gratitude and savoring. And what they found is that people who did these positive activity interventions who had chronic pain, they actually had less pain intensity. Their pain was less intense. They had fewer depressive symptoms. They catastrophized their pain less. They felt more empowered to maybe do something about it. Less negative emotions like depression and anxiety, and increased positive emotions like hope and joy. And then what was really cool is they did these little dinky things, and at 3 months, the effect continued. They still looked like they were having these benefits. That's why we do them. Okay, so here they are. The first one that I really love is a gratitude diary. And this is a simple thing to do. Has anybody in here done a gratitude diary? Yay, excellent. There's many ways to do this. The way that I like to do it is say, get yourself a diary, ideally something you like, a really great looking journal that makes you feel good. And put it by your side of your bed with a pen, and every day, at the end of the day, write down 3 things that you're grateful for. Think about it. It could be just 3 simple things. You can write about them a little bit, but each day, write down something different. So you're going to be good at this the first week. It's easy to come up with these big things. Week 3, you are stretching. I'm grateful for my socks. I'm grateful for cat whiskers. But you know what? It makes you open up to all these other things that are positive and actually look during the day. And it can be a very powerful exercise. Alrighty, another fun exercise is random acts of kindness. So this has been studied many ways and many times. And the way this seems to work best, the biggest bang for the buck, is yes, it's great just to kind of throughout the day do nice things for people. But the way it really works as an intervention is plan ahead pick a day down the road and plan 5 things that you want to do. This is going to be your Random Act of Kindness Day. Plan these events. They can be for people that you know and love, or they can be for total strangers. Maybe do one for you. And then on that day, just do all 5 of those acts. Be aware that people will respond to you weirdly. If you buy somebody a coffee at Starbucks, they may look at you, what are you doing? And then they realize, oh, a random act of kindness. We usually just say, hey, it's a random act of kindness, pass it on, have a great day. And then they think, okay, it's not so creepy.
The acts of kindness, these are just some of the data are associated with all sorts of good things for our health, ranging from health-related stress to decreased depression in people with diabetes, lower levels of pain, less cortisol, less anxiety and depression, and so on. So this is random acts of kindness. A silly thing is supported by good data. My favorite. If you guys take one, learn and do savoring. Savoring is a mindful activity that says that we have a lot of happy things that happen in our lives, and they kind of come and go. We need to make them sticky, because what happens in our brains when something negative happens, our brain encodes it. Boom! The dog barked at that poor poor video got boom. That's encoded now. Scary dog. A snake, you ran into a snake, encoded. You'll probably still see that snake 15 years from now. It's in there. We do that, our brain does that because it's a way of keeping us safe. What we don't do very well with the brain does is just encode positive emotions or positive experiences. We're just not good at that. So savoring makes us more mindful and helps us do that. So the next time you find yourself really enjoying something, it could be chocolate cookie or a cookie like this guy. It could be a warm shower. It could be time with a best friend. It could be the feel of your fluffy pillow. Whatever it is, just take a moment and say, oh, mindfully, remember this. This is great. What does it smell like? What are you feeling? What's going on inside your body? Be in that moment and say, I love this. I'm remembering this. And often this works wonderful with people that you love, because that just really helps us encode this social connection. So when you're feeling really close to somebody, what's this moment like? What do they smell like? What do I feel? Okay? Savoring is really important. It really is engaging the best parts of our mindfulness. Another one I would like for you to do, if you're one of those people who just is surviving, just doing the things that I have to do to get by, the work, the childcare, the errand running, okay? If that's you, after my talk, take out your phone again and pick a time in the next week. It could be 2 hours, it could be 3 hours. And schedule something on your calendar to do something you love. It could be your hobby, it could be going someplace lovely with a good friend, it could be just curling up and having a little spa day that you do with yourself and best friend, whatever it is, whatever you really, really love. You need to schedule these things on your calendar. This is part of your health.
This is for your mental health. This is to decrease your stress. This is to increase the likelihood that you're going to sleep well. This is really important. I hammer this home because positive activity interventions is one of the most powerful interventions we have for depression. Way better than medication. So powerful. I got something there, it's called an effect size, 0.87. That's how big the response is to something, and that's very big. Our response to medications is usually about 0.38. So that's much smaller, right? So it's a huge effect that most people who do this, wow, they actually have something. It triggers the little positive parts of our brain, it gets us moving, it gets us connecting, and life just all of a sudden doesn't feel so blah. So do something special, set it aside, plan the time. I write domains here, so a part of what we do in the book is we talk about these different domains that we want to hit, and this is such an important domain for a number of areas, for positive emotions, physical activity, and social connection. And this is something too, that again, this is helping us do a better job of encoding the things that are positive in our lives. So most of the time, I don't know if it's like, this is kind of my household, but we come home at the end of the day and we start off with all the stuff that was kind of crazy that day, right? The things were frustrating, for the person who just pulled out in front of me and didn't honk their horn at me, or whatever it is. And we often will just kind of talk about these things and not necessarily talk about the things that happened during the day that were great. And so the Positive Piggy Bank was developed initially to help women with breast cancer 2 weeks before the surgery. These are newly diagnosed women. They had 2 to 3 weeks before their breast cancer surgery. They're very stressed. My oncologist friend has said, I got nothing to give them. Is there something that you can kind of give them to do? And we said, yes, and we studied it. And so what we did is we gave these women a piggy bank, a bunch of little slips of paper, and a little instruction, little laminated instruction thing that says, every evening think about the people, things, or events for which you are happy. Or which made you happy. You may make a list if you like, pick one of these and spend a moment savoring it. What made it so special to you? Now write down this moment on your little currency slip. Use enough detail that you can remember later what was said. Perhaps date it, fold it up, and toss it into your little piggy bank. Do this every day for leading up to your surgery. And on the morning of surgery, we would call them and say, hey, open up your piggy bank and take a look at what you had collected there. And they reported that. No, first of all, they all did it, which I was shocked. And then they loved it. And they actually had less fatigue, less pain, just for 2 weeks leading up to surgery. We chose the pig because it's so out there that you see this on your kitchen counter and it reminds you to do that. So this is just a vehicle for doing something we call positive daily reflection. You can do a million different versions of this. You can have a box that you throw things in. You could do it every day at dinner with your family. But positive daily reflection is key. And then lastly, probably one of my favorites, we all have character strengths. These are our superhero powers. These are our strengths. We each have them. Everybody has them. The question is, what are they, right? You may know. So this taxonomy was created by Chris Peterson, Nancy Park, and Martin Seligman, and it was based on work that they did around the world, talking to cultures across the world about what they saw as values. And so the ones in blue on your left, those are the virtues. These are kind of agreed upon virtues. Almost every culture has wisdom as being important, courage as important, humanity, caring for each other, justice, temperance, and transcendence, some spiritual element. And then from those virtues, they identified what are the kind of the character strengths that go along with it. So across the top, you'll see wisdom, that kind of creativity fits there, and curiosity's there, judgment, love of learning, perspective. Those are kind of the ones that fit there. And what we do with character strengths is once you know what they are, we try to capitalize these in different areas of our lives. So if you've not done this before or never done your character strengths survey, this is really cool. This is Values in Action, or VIA. This is a free website. It's a nonprofit that does nothing but study values and cultures and humans around the world. And they collect these data. It's a gigantic repository. You have to register. You got to put your data in. You got to put your stuff in there. But what it'll do is it'll take you to about a 15 to 20 minute survey that helps you answer questions about your character strengths. And at the end, it spits out a free, only do the free if you want, the free PDF that has all your strengths and what the heck that means, and ordered. And so when you have a sense of what those are, I think what most people do is they kind of say, yeah, I really guess that. But they're almost always surprised too about things that pop in. They're saying, oh, I never thought of that as a strength. I love that. Interesting. And also look at the bottom and say, oh, I might want to work on that. So when people in our studies do their strengths test and they know what their strengths are, we usually have them kind of write down what are your 7 strengths. And then what we do is we challenge them to think about how do you usually use a strength in normal life. So let's say creativity is a strength of yours and you're an artist, so you use it to do your art. We say, okay, that makes sense, but how about if you use creativity in a different way? You're telling us about a lot of conflict you have with your spouse. How about using creativity to think about new ways to resolve that conflict? And they're like, of course, right? We often don't think about how we can repurpose these things we already do very well. Alrighty. So as I kind of wind down, I'm just going to tell you a little bit about some of the studies that we're doing at the University of Michigan currently, because it's kind of fun to see what's going on. So this is a study that we've been conducting for 5.5 years throughout the pandemic. It was a real trip. I'm working on this with my co-PI, Dr. David Williams, who's a fellow pain psychologist. And what we did with this study is we said, okay, cognitive behavioral therapy for pain works okay. It works pretty good. People kind of get bored. And so we thought, how about if we jazz it up? How about if we stick some of these positive activities in it to make it more engaging, but also to start tweaking that part of the brain for positive emotion. And so we did that. So we've been randomizing people just to get regular treatment. And one group gets our standard cognitive behavioral therapy, and one group gets the cognitive behavioral therapy plus savoring, mindfulness, and gratitude and character strengths. And then we're looking at, whether or not it makes a difference. So the way that this program works is people get a activity a week, and it's coached by our medical assistants. They were all really excited about this because MAs are ubiquitous, they're in every setting, and they're underutilized. And so they became our health coaches. And so they call the patients every week and they talk about the next activity. And it's gone well. I'm gonna tease some of the results. I might have a little bit because we haven't even published this yet. We're just analyzing the data. And what we found is that, yes, as we kind of anticipated, that adding these positive activities to the intervention really does help. But what kind of blew our socks off is the big effect is 6 months and a year down the road. So that people really saw the benefit later, which tells us something about kind of the brain, and that it takes a while to rewire and that people's habits change. But that was so exciting to see that this little intervention they did for 8 weeks here, a year later had really big effects. So it's very cool. We're doing a study in scleroderma with Susan Murphy. I hope you all have met her. She's a friend of Dr. Poole and mine. So this is an intervention that I worked with them to create to focus on fatigue in scleroderma. And what we've done here is very similar. We've taken kind of cognitive behavioral therapy, focused it more sharply on addressing fatigue, and woven in some of these positive activity interventions here. So it's an online program. We also have an app that works for it. They get these really nice activity interventions, and then they have peer health coaches, which I love. These are other individuals with scleroderma who go through our coaching program and just work with the other patients as they go through this program using this app. And what we found here is results are really good. That here too, we found that the people who got this intervention had infinitely less fatigue, much less pain interference, and higher levels of resilience. And so we are currently writing a very large grant to study this better in people with scleroderma. And then another study that we were very proud of. This is also taking this to a very underserved population, especially post-pandemic. These are individuals who live in the underserved areas of Detroit, largely African-American, older population. And we worked with people in the community about how do we tailor this? How does this feel culturally relevant? And brought on here too health coaches who are amazing and work in the community and know the community well and know the individuals kind of in their neighborhoods. And again, we've just kind of adapted our positive psychology interventions. So we have them doing, first of all, walking. So everybody gets a Fitbit and they get to walk. We have them doing what they love, which is really kind of positive activity scheduling. So, making time to do these things you love. We have them doing life highlights and review, which is, ways of writing about the things that really peaked in your life, the things that were so special. We have them doing random act of kindness, as well as keeping a gratitude jar, and also savoring. But my favorite is the feedback that we got from the population is like, where's the music? Music is so powerful and important to all of us. As we're like, music is medicine. So we work with them to craft a module that just focuses on bringing music into your life. And what we saw with this pilot study is that the effects were pretty powerful, that 86% of the people that got this intervention reported that their functioning was better compared to 25%. And then their pain was much better in 67% of the people who got the intervention compared to 21%. So we're super excited about that. And that one actually, this is the pilot study. We've actually gotten an R01 for this too. So we're currently conducting the study. I think we're about 100 patients in and have expanded the intervention and our health coaching. So it's been very exciting. And then lastly, this is my lovely colleague who's also an oncologist. She does bone marrow transplant, and she came to us and said, my caregivers are bowled over by having to care. This is the hardest care that we ask people who are non-medical providers to do, caring for a patient with bone marrow transplant. Can we give them something? And so we worked on creating this positive psychology intervention for them. And so we created an app that delivers the positive piggy bank, like you guys saw, savoring, acts of kindness, positive activity intervention, signature strengths, writing a love letter to the person that you care for, and engaging with beauty. And so they also have in this app the ability to communicate with each other. And so there's this element of social support too. And so everybody kind of talks about these things that they're doing together and the care of their patients. And we also have it integrated with Fitbits and other things so we can help them monitor the levels of pain, sleep, and function. And here too, we started in this caregiver community, and now this app has gone kind of everywhere. So during the pandemic, we had college professors and staff using it just to kind of help with mood, and they loved it. We gave it to students, and so we've had a couple thousand students do it too. And we're currently studying it in both people who are undergoing bone marrow transplant and their caregivers to see if maybe there's mutual effects, what we call dyadic effects. So again, we are kind of trying to look at all of these ways in a very scientific, careful way, how we can kind of broaden this notion that resilience can matter in a healthcare setting. So what's in it for you today? Well, you've learned a lot of these wonderful kind of interventions. I hope you'll use them. You have them in your handouts so you can refer to them. The best thing to do too, share them with others. Right? These are the types of things we can pass on. These little interventions do not take a psychologist to deliver or anybody with a license. It really, you just take, hey, random acts of kindness, let's do it. We have a guide, so we have a resource at the University of Michigan. It's called Pain Guide. This is open, free to use for anybody. You just put a Pain Guide in the Google machine and see what pops up. You can go in there. There's a section that's called Pain Care. If you click on Pain Care, click on self-care, and you'll get a number of interventions that we have here, but also the cognitive behavioral therapy for pain interventions that we study kind of across these studies. So learning about pacing and nutrition and exercise and managing emotions and so on. That's all there for you to access. If you click on each of these, there's a bunch of information that pops up. And let's say you said, hey, let's learn more about resilience. Well, I come up. And so there is more information about these things that we're doing here today. Another thing we mentioned earlier is my book. So this was my pandemic project after I got done watching every episode of Lost from beginning to end, twice, and every Star Wars movie in release order, not actually chronological order. I decided I needed to do something better with my time probably. And so I said, why don't we translate what we know in science amongst ourselves, all of us in our little silos, for individuals who really live with chronic pain. And so this book was written to people who have any form of chronic pain, including autoimmune disease, osteoarthritis, on and on and on. And of course, the chronic low back pain, fibromyalgia, what we think about as widespread pain conditions. And what it is just a focus on self-management, about, first learning about the neuroscience, a little more depth than we spoke about today, but hopefully really light, and patients helped me write bunches of it, so hopefully it's nice and clear. And then we explored, just like we were talking about, the role that our thoughts and emotions play in chronic pain. But the part that I really love about this book is the hands-on part. What happens is after you read the chapters, which I hope are very conversational, I tell a lot of stories. Not as many, they didn't let me tell me as many as I wanted, but I tell a lot of stories. And you have a 30-day trial period. So what you'll do in the middle of the book is you wake up every day, you open it up, and there is a new activity, skill, or practice to consider. You read about it, you think, okay, this is how I would deploy this today, and you give it a try and think, I kind of like that, I might do that. Or you think, I love that, I so want to do it. Or you think, that is so stupid, I will never do that, right? So ideally, at the end of the 30 days, you've maybe identified 5 to 10. I've had people say, I've got 25 now. But ones that you actually like. And then what we do, the back end of the book, is I help you create something called a thriving plan, which kind of helps you prioritize which one to do first, how to do it in an orderly way, because you can't do them all at once. Do one at a time. And a thriving plan is something that you build on, and the ones that work become habit. You don't even know that you're doing them. And the whole goal is that you address the parts in your life that need addressing. So we work on sleep, emotions, toxic families, trauma. We talked a little bit of everything, but anyway, so that's kind of the notion of the book. And then, creating this thriving plan, which is kind of a living thing. My favorite part are stories. I have 11 lived experience stories, which are just little 2-page vignettes. It's not how I got sick and what happens, like, ooh, this is what I learned. This is what mattered to me. This is what changed. And then, and I have a podcast. So we just released this about 3 weeks ago. We have, you can find us on Apple and Spotify and every place that podcasts are. And what I do is I alternate. I interview chronic pain experts and clinicians one week, and then I speak to people who with lived experience the next. And I'm sure there's probably people in this room I should be talking to talk about scleroderma to the wider audience. But they're lovely. They're about 40-minute just conversations, and they're just a lot of fun, and just learning about what's the latest in science. How do people cope, and just telling stories, remarkable stories. So moving forward, we use these principles to build joy in our own lives. I hope you do that. We hopefully do this as researchers. We hope you do. I want to shout out to the people that do the real work. We have a lot of grants going on simultaneously. Sometimes I say I can't even count how many studies we have going on simultaneously because it makes me kind of freak out. But these people do the work, so they're absolutely amazing. And you can find me at aftonhassett.com too, or at the Chronic Pain and Fatigue Research Center at the University of Michigan. So thank you.